Hello everyone, my name is Unnati. We, the PR team, had conducted a survey in Church Street, MG Road, about the menstrual cup usage, and the target audience were 18 to 30 plus youth and women. The findings were positive and negative, and the negative comments were tending towards the taboos in general and the lack of knowledge in the product. So, as promised, we are here with the podcast with the resource person, Dr. Kamalini Venkat. So, continue watching to get answers to your questions and stay tuned for more updates. Thank you. Hello everyone, I am Unnati and we are from Consumer Club in MES Invigorate, and we had conducted a survey in Church Street about the menstrual cups, and we have received some questions which we'll be asking the resource person. We have Dr. Kamalini Venkatesh here. She has done her MBBS, so now I'll ask her to introduce herself.
Hello, good afternoon. I am Dr. Kamalini Venkat. I am practicing gynecology from past 30 years. So I come here to talk about this menstrual cup and its awareness.
So I'll start off with the first question. Can you tell us what is menstrual cup and how it is different from pads?
Menstrual cup is one of the menstrual hygiene devices. It's in the cup shape of a cup, and like it is introduced into the vagina for the collection of the menstrual fluid. Whereas the pads, they are cotton devices which they are kept in the vagina to collect where it's an absorbent. The cotton is more an absorbent, whereas this one is like a device to collect the menstrual fluid.
So which would you suggest your clients to use?
It depends on each one's affordability and convenience.
Okay, so if a person who is interested to switch to the menstrual cups, would you recommend it? Can you state some advantages for it?
Definitely, I would recommend menstrual cup because it's more hygienic also. And see, in a menstrual cup, the menstrual fluid remains in the fluid state itself. At the most, it can get clotted to some extent. But whereas in the pads, it gets absorbed over the cotton which is given, or some dragged cloth. Some people use dragged cloths. So there it gets absorbed. And keeping it for a longer time is more irritant. They are forced to to change within 4 to 6 hours. Unlike this menstrual cups, they can change it once in 12 hours. Sometimes if the flow is less, even for 24 hours.
So what are the difficulties which a person faces when they're switching to menstrual cups?
Method of insertion is the first priority. Like it has to be taught initially. Some who are very intelligent and who have got access to this media, they go through this channels like WhatsApp and all, where they can use it, Google, and they Google, gain some knowledge, and they try on their own. Until they face some difficulties, they're not up to us. But at least most of the women are not aware of this. Even to this day, they use only tampons and pads. Most of them only pads. Tampons also are few.
Okay. Do you think it's because of the society which India is put through, or the mindset which is...
No. It's people are not aware.
Okay, so that's the reason.
Yes. Awareness is very less. In fact, in my clinical practice only, for so many years, I think only from past 2 years, I'm seeing a few girls, that too hardly 4 or 5 I've seen using this menstrual.
So the ratio is very less.
Yes, very less. And it's more in young girls, that is less than 20, 25.
Okay, so my next question will be, how reliable are menstrual cups for heavy periods and heavy flows?
See, there are different sizes. So if it is heavy flow, they can go for a larger size, which can fill at least around 25 to 30 ml of menstrual fluid. And only thing is they have to change it maybe once in 6 hours. That's all. But it's reliable. Even for heavy flow, it's reliable. In fact, we advise them for postpartum also.
Ma'am, can you explain what that is?
Postpartum is the period after delivery. The 3 months after delivery is called postpartum period.
Okay.
Where usually the flow is more heavier. Immediately after delivery, the first few days it will be very heavy.
Okay. Does using menstrual cups give out any odor or?
Is it? No. We didn't know about it.
So when we interviewed girls in the church street, they were actually scared about the taboos which were put on them, and it was in their mind. So can you break down on those? What are the some taboos which prevents them to use the menstrual cups?
What are their fear? I don't know. That's better if you can tell me clearly.
So they were skeptical about inserting a foreign object into their body.
It's not exactly a foreign object. Like it is made of this medical silicone. Okay, which are very safe to be used in human body. In fact, we use them for certain ear operations and for, uh, I mean, like we do any sutures. We use this. Yeah. So it is. I mean, regarding the material, it is quite safe to be inserted in the body.
Okay. And also, they were scared about their virginity being lost.
That hymen tear, and
Yes.
that some have got that. No, it doesn't. Not at all. Only thing is, like very young girls, say between maybe around above 15, between 15 to 17, where they are very scared even to touch and feel their, I mean, even the perineum or vagina. Those girls are very, very scared. So maybe after 18 and on, they are comfortable. If you teach them, they grasp it. And I think the method of introduction should be taught to them properly, like how you have to insert it. There are three methods. I mean, if they approach a doctor also, they will advise. So that is the only thing I think some girls are very skeptical about. And maybe they are worried about the infection part. Definitely with proper hand hygiene and all, you may not worry about that, like any infection and all that. In fact, it reduces especially in young girls, no? Say between 20 to 30, sexually transmitted diseases and other much, much, much reduced.
Okay. So we all know that pads, most of them use pads, but we know the composition is not good for the health because it's a medical product. So they don't give out all the composition or the chemicals used so that it stays so long. So can you state some of the side effects which pads causes in the girls?
See, the pads is nothing but cotton, which is, covered with a absorbent, you can say paper like, okay, which is absorbent. So once it gets absorbed and when it stays for a long time, it irritates the vagina. I mean, the perineal regions. It irritates the perineal regions. So that can cause rashes, that can cause infection. They have to change it at least 6 hours. Every 6 hours, they have to change the pad. That's a must won't be done. Whether it gets soaked or not soaked, they have to change it. So unlike that, that is kept externally. No? The pad is almost external. Whereas this is within the vagina. Vagina is supposed to be more hygienic and the pH is maintained by our body itself. You don't put anything to maintain the pH or you don't clean the. It is an internal organ. So there are self-cleansing methods there itself. So the rate of infection and all is much less when you use cups rather than pads. And that odor, all that is, you get bad odor when you keep it for long or when it is over soaked. Even if it is over soaked and it's 3 or 4 hours, you get that smell, that odor. So which is not.
So can you tell the composition of menstrual cups? What are they made of?
It's made of that medically used silicone or latex, or there is another thing called TPI or something, thermoplastic form device. So I'm not very sure of that TPI. Open. Okay, but the commonest ones are the silicones. And they are quite safe and they are more easily compressible and they are not irritant to the vagina. So that's how elastic ones are more commonly used.
Do menstrual cups leak when we are outside or we're doing some sports like swimming?
No, it doesn't. It's very safe that way. You can have your sports activities like swimming, cycling, running, marathon, all that with the cups. Okay. So most of the times you don't feel that it is inside. If you have personally used it, you know that you will not know its presence.
So, in the process of the interview, we actually came across a foreign person who told us that in their country, in foreign countries, the menstrual cups are very common. Like, nobody uses pads or tampons. They are very, open to menstrual cups, and it's just very common there. But in India, it is not like that. So, can you elaborate on that point? Why is it like that? And why is it not introduced in our society, or why is it not so common in our society?
One reason could be of that taboo itself for menstruation, like how our elders and all, like the moment a girl menstruates, she's kept away, yes, and I mean away from all the activities. Yes, leave alone, and she's kept to one corner and secluded and all that. That is one reason people do not want to do more of research or see for the comforts of a baby with bringing more innovations in this use of mental, I mean, pads or cloth. It was just a neglected part, like how most, even in those days, the ladies were like this is also a neglected part of it. And only now, like when the girls started being more educated and trying to live on a road and being more employed,
Independent.
yeah, more independent. This has come into, I mean, the menstruation is more highlighted. Like, because when she has to work, you know, what are problems she'll undergo for those days, or the 5 to 7 days. So only now that awareness has come, only because of the younger generations.
I think I did. Okay, so now we know that in the before days, people used to use cloths because there were no pads introduced. And then later we got pads, and we started using pads, and tampon and menstrual cup came into the picture. But now we have cloth pads again coming into picture, and the before years whatever they're using coming into picture in a modified form. So do you think that is advisable, or elaborate your views on that one?
No, I feel like menstrual cups, the awareness must increase. It's not there. You know how, like when I ask for the medical store in my neighboring medical stores and the nursing home, they do not have it. So you know how much it's being used.
Yes.
So I think one way what you are doing is right, bringing more awareness. And once people are aware of it, definitely they start using it. See, it's not only the cost. In the long run, it's more beneficial to the patient, I mean, to the user itself.
And also the environment.
Yes.
It's more.
It is, yeah. Unlike the pads, which cause more of solid waste and
Because
ecologically it's not friendly, but this is more friendly.
it's more
You
useful.
can use it for at least 10 years. 5 to 10 years, you can use the same cup.
Okay.
And the way of disposing the material, that is the menstrual fluid also, is more hygienic, no? You just directly pour into the drain. Whereas this, it gets absorbed. And imagine if they have some infections, it is even a spread of infection. That's one disadvantage of using the packs. But I think the awareness is very, very, very less. So it has to be increased.
So what would your suggestions be if a person or a woman has to change from pads to the menstrual cups?
I would always recommend a menstrual cup more than the pads, because these days in my practice, I'm getting more of this young girls and women coming with vaginal infections more frequently. So one reason could be because of improper hygiene during their menstruation. Like if they are using the pads and all, they retain it for long hours, maybe over 6 to 12 hours, because they cannot dispose it at the, I mean, there are no proper surroundings to dispose the pads. But unlike the menstrual cups, they don't need it. All that they need is it stays for 12 hours. They can come back home and do whatever is necessary. Just discard the menstrual fluid and rinse it, and then again reuse it. But so it is more easier if they start using menstrual cups compared to the pads.
Thank you so much, ma'am, for making time and giving us these inputs. Sure, it will be helpful for the viewers. I have a menstrual cup right here, and as the doctor will be demonstrating the process and how it is.
This is the menstrual cup in a packet. This is how it looks. This is the stem of the menstrual cup with small circles on it. And this is the base of the menstrual cup. And here there are about small holes, about 3 or 4 holes on it to release the pressure when it is full, when the cup is full. Okay. There are different sizes in this menstrual cups: small, large, and medium. Small, medium, and large. Then the small one holds around 15 to 20 ml of menstrual fluid. The medium one around 25 to 30, and the large one around 30 to 50 ml. Okay, and there are 3 methods of using a menstrual cup. One method is called the C method, where you turn it in the form of letter C, and then just insert it like this. And if this is the vagina, if this is the vagina, you have to just insert it like this, and then it will open by itself. That is the method. Then there's another method called pinch down method. So where you will have to pinch this like this, and so the circumference becomes smaller and easy to insert. You pinch down like this, and then you insert it. This is another method. The other method is that number 7 method, where you do it like this. You know, if you can see it properly, this is how you do it. And then you insert it like this into the vagina. These are the 3 methods. And these perforations are there because when it gets full, all that there to prevent leakage. When the pressure goes up, because of the menstrual fluid being full, when the pressure goes up, the air is leaked, it comes out through these perforations. That is the advantage of these perforations. Only if these perforations are blocked, sometimes there will be leak. So maybe once a month when you clean it, see that these perforations are open. That's all. And the method, insertion method I have shown you. Now the removal method is, all you have to do is pass your finger from the stem along the cup to reach the base. Then once you reach the base, you just press it. Don't pull it out. It will be uncomfortable. So just press it like this and then slowly remove it. Have a tissue paper or toilet paper or tissue paper on the other hand, so that you can close it. The moment you remove it, you'll have to cover it. If not, there'll be spillage on your clothes and unnecessary in the other places. Menstrual cups are available in transparent and colored ones. I prefer colored ones because the transparent ones, as time goes, they get discolored and it has yellowish stains, which doesn't make comfortable for the user also. The colored ones are easy to clean and they look good without any stains. All that you have to do is, monthly once, you'll have to boil it well to sterilize, dry it, and then keep it ready for use the next time.